This is a Mohalla clinic in Delhi's Todapur district. Seeing 60 to 70 patients a day, the clinic's physician spends 4 minutes per person. And now each of his patients is contributing to public health data. Gathering and analyzing real-time big data of nearly 3 million public health consultations across Delhi is the 2-year-old Bangalore-based health tech startup MedOnGo. Founded by BTech graduate from the Jawaharlal Nehru Tech University, Balaji KRISHNAMAGGAru, his startup does corporate data analytics to support itself financially, but his heart lies in improving public health.
So that patient engagement between the doctor and the patient is the most critical thing.
By joining hands with Delhi's Mohalla clinics and the Wish Foundation, over the last year they have onboarded over 100 clinic doctors.
नहीं, स्टार्टिंग में तो परेशानियां आती हैं, उसके बाद धीरे धीरे जब हम इसके साथ कंफर्टेबल होते गए तो इजी हो गया। अब तो हमें लगता है कि ये ज़्यादा इजी है पेन पेपर से। कभी कभी ऐसा होता है कि पेशेंट स्लिप खो देता है या फिर पेशेंट पहले टेस्ट करा चुका होता है और फिर आके बताता है कि हमने तो ये टेस्ट कराया नहीं है। तो ये हमारे पास डाटा स्टोर रहता है, तो फिर हम देख लेते हैं कि पेशेंट ने टेस्ट कराए हैं या नहीं कराए।
Each doctor is trained to enter patient data into a tablet which stores personal details, symptoms, diagnosis, tests and prescriptions per visit. And this helps create a record for patients that otherwise lack one.
This technology helps us look at the data analytics, the electronic health record of the people, the clients, the patients that come in, which was something which was not fully available or even partially available, I must say, before advent of this into such settings.
Over the last year, with 70% of patients being women, children and the elderly, and 30% being repeat consultations, this system has gathered immense data regarding public healthcare on the ground.
Before the fever season sets in, if you'll see the dispensary medicines that are being given out to the clinics, there would be a sudden rise in paracetamols and other medications, for a simple reason that they know that we're going to see more cases of this.
In 2016, WHO reviewed India's national health surveys and found that while health data is crucial for decision making, India lacks an effective system to provide such information across the country. Data collected in these Mohalla clinics can be sliced by age, sex, geography, disease pattern and more, which MedOnGo has made accessible to the Health Ministry and can be used to identify trends and make public health policy measures, such as several cases of typhoid in one Mohalla or district could indicate water contamination.
If you maintain the data in tab over the years, then you can retrieve the data and you can know the trend of the disease in a particular year, in a particular weather, in a particular season, and you can design your public health strategy for prevention.
It is also linked to an automated 60 medicine capacity vending machine, which reads signals off the tablet and immediately releases the prescribed drug. While a year later they have gathered data worth 3 million consultations, the road getting here was not easy. The first challenge they identified was patients that had no ID proof or phone number.
How do you identify a patient uniquely? Now he doesn't have a unique ID, Aadhaar, he doesn't have a ration card, he doesn't have a mobile number. How do you identify? Then we have to devise mechanisms.
Their solution was a smart photo tagging system that recognizes faces along with the patient's mother's name as a second layer of identification. Next came training over 100 doctors to use this tablet.
Initially, bringing in the technological dimension into the day-to-day working was definitely a challenge, including the hands-on operation on the tab.
How do you baseline these to from a doctor who's tech savvy and a doctor who's phenomenal in his field and a doctor who wants to improve himself? And how do you bridge this with the medical administrators?
Since the tabs have an offline feature, they can be used in areas with no signal as well. And MedOnGo hopes to expand this to public health in other states later this year. MedOnGo's system has collected data worth 3 million consultations since April 2016, and this data can be analyzed through sex, age, or even geography, and this can then determine disease patterns such as several cases of typhoid coming from one area, which can also be used for preventive action. In New Delhi with camera person Sachin Gupta, Real Media, NDTV.